Joining us for today's COVID-19 update is Monroe County Public Health Commissioner Dr. Michael Mendoza. Today we'll have some vaccine and testing news heading into the holidays, but first we do want to discuss the numbers. Today we're reporting 471 new COVID cases with a 7-day average of 430. Last week we reported 550 new cases and a 7-day average of 370. Unfortunately, as we've seen before, a rise in COVID cases is translating to a rise in hospitalizations. As of yesterday, there's 336 patients hospitalized in the Finger Lakes region due to COVID-19. 97 of them are in the ICU. I'm going to let Dr. Mendoza talk more about our health systems are seeing, but I can say the overwhelming majority of these patients are not vaccinated. This is a perfect example of what it takes to defeat the virus, and that is to get vaccinated. Wear a mask in public, indoor spaces, get tested if you're not feeling well, and do not go to work or gatherings if you're sick. Thanksgiving is now just a week away. Last year, we saw a surge in cases over the holidays, but unlike last year, we have a proven way to keep our family gatherings safe. Please get vaccinated. To date, Monroe County has delivered more than 523,000 doses of COVID-19 vaccine. Before providing an update on pediatric and booster vaccine news, I want to first build on what we discussed at the Monday press conference we held with my colleague, the Erie County Executive, Mark Polenkars. The increase in cases and hospitalizations is concerning. Dr. Mendoza and I are particularly concerned about family gatherings this coming week. Such gatherings are a perfect setting for the spread of COVID, where people will be indoors eating and celebrating with loved ones. To help ensure our residents are safe and healthy when they gather, today, I'm announcing the county will be expanding our offerings of free rapid antigen testing leading up to Thanksgiving. Next week, we'll be offering free testing at locations in the city of Rochester, Pittsford, and Greece. On Monday, Tuesday, and Wednesday of next week, free testing will be available at 804 North Goodman Street in the city of Rochester. We'll also be providing testing on alternating days at our Pittsford Plaza and Greece Ridge vaccination clinics. Appointments for these new testing opportunities are available on our website today. Testing prior to the holidays will put your mind at ease before celebrating indoors with friends and family, including those more at risk, such as grandparents and young children. We can avoid a spike in infections like we saw last year after Thanksgiving by staying away from family gatherings if we feel ill, or getting tested before attending a gathering. The test is fast, it's easy, and it will give you peace of mind. Dr. Mendoza will discuss the benefits of testing further in a few moments, but consider how much better you will feel knowing you're not infecting others. As our infection rate and hospitalization rate clearly shows, COVID isn't done with us. On Monday, we also talked about the importance of booster shots. Many of us, including myself, were vaccinated more than 6 months ago. After 6 months, while still strongly protected against serious illness and hospitalization, immunity is less effective at preventing breakthrough infections. Booster shots will reinforce immunity and keep you safe. I too got a booster shot earlier this week. You can get a booster of the J&J, Moderna, and Pfizer vaccines at clinics across the city of Rochester and Monroe County. Appointments for boosters are filling up fast, so I encourage you to please get a booster today. It's another effective way to keep yourself and your loved ones safe this holiday season. Who's eligible? Anyone who's 6 months past their final dose of Pfizer or Moderna vaccine, or 2 months past their Johnson & Johnson vaccine. Here in Monroe County, booster shots are open to anyone who feels that they are in an increased risk. Based on our numbers, the Finger Lakes region is still at a high risk than other areas in the state. So you are welcome at a county vaccine site to get a booster if you are past the allotted time of your initial dose. For our newly eligible kids, ages 5 to 11, we're continuing to expand the number of appointments available. This weekend, we have more than 700 vaccination appointments available at our Greece, Pittsford, and City of Rochester locations for pediatric vaccinations. Anyone interested in booking appointments should continue to visit monroecounty.gov or can call 211. Vaccinating our children is a proven way to protect them and the rest of our families. It's also the best way to ensure they stay in the classroom and learning. Remember, all minors must be accompanied by a parent or guardian at our vaccine sites. I also want to note that this is the last week of our gift card incentive for getting the vaccine. Up until November 23rd, we will continue to offer $100 incentives to individuals 12 and older who get the full COVID-19 vaccination series in clinics where we have lower vaccination rates. For Pfizer and Moderna vaccines, those receiving their first dose will get a $50 gift card and receive another $50 gift card for their second dose. Those receiving the single-dose Johnson & Johnson vaccine receive a $100 gift card. You can find participating vaccine clinics by visiting the Finger Lakes Vaccine Hub website or by calling 211. Before turning it over to Dr. Mendoza, I'll provide one last update on numbers. For testing, as of today, we've performed 1,205 tests at our Fleet Center rapid PCR testing sites for school-aged children with 79 positive results. That means more than 1,100 children could go back to school the following day without having to wait up to a week and days to return to the classroom. Again, these rapid PCR tests get results in hours, not days. Monroe County has also distributed nearly 150 rapid PCR testing machines to dozens of school districts and private schools, along with more than 11,000 testing cartridges as part of our efforts to keep our kids healthy and to keep our kids in school. I just gave everyone a lot of information, but there's also a lot of common sense to what we're saying. So let me provide a quick summary. Thanksgiving is next week. Here's what we recommend to you to keep you and your loved ones healthy. Please get vaccinated if you haven't already. Get a booster shot if you're eligible. Wear a mask when gathering in public places, indoors, and are unable to distance. If you're sick, please stay home, call your doctor, and please get tested. And now here's Dr. Michael Mendoza, the Monroe County Health Director.
Good afternoon. Thank you, County Executive Bello, and thank you as always to the media for joining us here today. The last week has brought a dramatic rise in new COVID-19 cases in Monroe County, paralleling what we are seeing in surrounding counties and the Northeast as a whole. I attribute this to a number of factors. First, this is still Delta. We have no evidence to indicate that a new variant is circulating locally, and current data show that Delta comprises 99.9% of new cases across the country. We know that Delta is more contagious, and for us, it's coming at a time when it's colder, leading to more indoor gatherings, and at a time when we also know that existing vaccines have begun to lose some effectiveness in preventing infections. New York State data show that vaccine effectiveness at preventing infections has fallen from 91.8% compared to unvaccinated individuals in May to 79.4% compared to unvaccinated individuals in late October. These so-called breakthrough infections are coming sooner than expected, but fortunately, boosters so far appear to be effective at preventing breakthrough infections. The vaccines, however, remain highly effective at preventing more severe illness, holding steady at 90 to 95% effective in this regard compared to unvaccinated individuals. And as you heard last week in our local hospitals, you are 10 times more likely to be hospitalized if you are unvaccinated compared to if you are. Much of our recent increase in cases has been in children. While it is true that the vast majority of children who contract the infection will experience milder illness, we also know that a small proportion will have severe illness, putting them at risk for long-term disability or worse. I realize the numbers of these are still relatively small, but in my view, no child's life is trivial, nor one that we can simply label as a statistical outlier. I believe we need to do everything reasonable to protect our children while they are still susceptible to the infection. But what is most concerning to me is the increase in hospitalizations. Those in our community who are sick enough from COVID to need to leave their families during a time when we would otherwise much prefer to be celebrating together. As we look ahead to a time when COVID is endemic, when we treat it more like a communicable illness of other types, we need to own up to the reality that what we all want is to stay healthy and out of the hospital when possible. In medicine, we focus a lot on preventable hospitalizations, accepting the reality that older people and those with complex medical histories are hospitalized at a higher rate at baseline. But when someone is young and otherwise healthy, we get especially motivated to prevent hospitalizations, especially when there are proven safe and effective ways to do so. We take medications to keep our blood pressure in check and to keep our blood sugar levels in control. And we have relied on vaccinations to keep us from getting hepatitis, meningitis, pneumonia, and a whole host of illnesses that would otherwise land many in the hospital. Getting a COVID vaccine, especially now that it has passed all of the usual review protocols and has been given to billions of people worldwide, is really no different. But vaccines take time. In the case of the COVID vaccines, either 2 or 5 weeks to give us protection. And for many of us who are looking for what we can do right now to protect us, we need other steps. This brings me to the topic of Thanksgiving and gatherings in the next week. Unlike last year, I do not think a simple gathering size or capacity restriction fully captures how we should be thinking about gatherings at this time. Getting your vaccine and booster, if it's time, is still the most important precaution to take. But with a week of time left before Thanksgiving, we also need to keep thinking about other ways to stay safe. Beyond the vaccine, masking remains the most important personal mitigation step to prevent transmission, especially indoors when in close contact with others for prolonged periods of time. If you are indoors, consider keeping your mask on. If you are in a larger crowd, around other vulnerable individuals, and or if their vaccination status is unknown or unvaccinated. If you're enjoying a meal and cannot mask, consider ways to go outdoors if possible, or encourage more physical distancing indoors. Regardless of their vaccine status, we know that 30% of our recent cases are among people who have been vaccinated, most commonly more than 6 months ago. That is why it makes sense to get your booster, and getting it now before Thanksgiving is as good a time as any. And this is also why it's reasonable to get tested. Again, even if you are vaccinated, it's the best way of knowing whether you are actually contagious, whether you are vaccinated or not. As you heard, rapid antigen tests can be used in the proper circumstances and can be highly effective for surveillance purposes, especially when prevalence is increased like it is currently in Monroe County, and especially for detecting contagious COVID in the day or two leading up to an event. And if you want to do everything possible with the December holidays in mind, get your vaccine or booster now. I believe we have far more people already eligible to get the vaccine booster right now than people realize. If you are 65 or older, if you have any of the eligible medical conditions, or if you believe that either through your occupation or social circumstances you are at high risk, you are eligible. Right now, while policymakers weigh the process of expanding eligibility, know that from a clinical standpoint, scientists believe there is every reason for all adults to be eligible now to get their booster. And finally, I want to turn our attention to schools. As I said earlier, much of our recent increases have been in the schools, as students in the schools, but we thankfully don't think the transmission is happening in the schools. Apart from the relatively small but real health risk this poses for our children, the rising case numbers threaten to, and already have, disrupted what we and what our schools and teachers have worked so hard to preserve: safe instruction and open schools. As long as we are in this pandemic and isolating and quarantining, infected individuals will need to be excluded from school regardless of how sick or not they are, and their unvaccinated close contacts will too. This is chaotic and we can prevent much of it by getting our 5 to 11-year-olds vaccinated and by being careful with gatherings in our homes, our youth centers, and before and after school programs. This is where we are seeing evidence of spread, especially lately. We are not currently seeing evidence of major spread in schools because this year, like last year, students in the schools are wearing their masks. We are seeing increases in high school students who are by and large already vaccinated because they are gathering unmasked outside of school and because many of them are approaching 6 months since they received their initial vaccine series. I ask all parents to recommit to what we all did last year, masking indoors whenever possible. And finally, I have approved a protocol to implement test to stay in all schools who wish to do so in Monroe County. I shared the final protocols with schools yesterday, and they are already at work trying to work through the significant logistics of making it happen. To recap, test to stay allows students who would need to be quarantined, that is unvaccinated students who are within 6 feet of an infected individual for more than 15 minutes, to test to stay in school. For Monroe County, I have decided for now that includes school-related activities, athletics, and performances, and that it will also apply to exposures that occur inside and outside of school. It does not mean the individual is out of quarantine. It only means that they can test to stay in school. They would still need to proceed with all the other aspects of quarantining, meaning no sleepovers, no house parties, and no other activities out of school. All of the activities that we have seen in many, many of the recent cases that have been leading to COVID-19. And remember, this is only necessary for unvaccinated students. Test to stay is due to begin on Monday, November 29th, following the Thanksgiving holiday, and some schools will begin piloting some of their test to stay procedures before then. With that, I will hand it back over to the communications team for your questions. Thank you.